Hello everyone, I'm Sang-Chul Lim. As mentioned in our previous session, our new format, monthly surgery video, begins with a follow-up from the previous case. After that, we will present this month's surgery procedure. As always, the surgery was performed by Dr. Chung today. Today's topic is Crestal approach plus with compaction drill. Through today's procedure, you are able to learn how to perform Crestal approach of the sinus elevation, especially using the DASC simple kit. Now, let's take a look at today's case. About the previous session follow-up, previous session was done by upper anterior aesthetic areas, as you know. So the extraction of teeth 12, 11, and 21, 22, all four upper anterior teeth was removed, and implantation on 12 and the 22, the lateral incisal area, using bright tissue level, and bone grafting and soft tissue grafting. Use osteogenocollagen and collagen graft 2D, and the graft volume control during socket preservation for aesthetic, the protrusive profile of the patient. So make up some protrusive profile will be corrected by this kind of the surgery procedure. Okay. Pre-op was here, some labial version, and loosened the teeth of upper anterior, so extruded and wired ligatured with orthodontic on the lingual surfaces of upper anterior. And this one is pre-op PA here, and this pre-op PA taken by virtual panoramic view of Dentium, the company. And this one is pre-op CT, 12, 11, 21, 22 areas was shown very narrow and some destructive socket situation. And the post-op situation here, the two implant bright tissue level were installed, number 12 and 22 lateral incisal area, and the central incisal area, both of central incisal area was done by ARP concept, the socket preservation, using osteogenocollagen, collagen graft 2D. Okay, the post-op panoramic view here. So the very nice, well done implantation on exactly the same socket area, lateral incisor. And COMBIM CT view shown us about the correct and the precise insertion of this implant system, the bright TL, on the socket area. The extraction, immediate implantation case, actually 12 and 22, the precise insertion exactly point, the correct and ideal point between the both cortical plate, buccal and the palatal, and engage cancellous bone, the very nice engaged with implant surface with cancellous bone, as you know, as you can see. And this one is temporary crown on the same day of surgery, right? So this PMMA, a temporary crown with wing attached the neighbor natural teeth, the screw hole, the open on the labial side, using with a digital abutment. And this one is actually a delivered situation to my patient and the same day of the surgery, and the bonding to the lateral canine, the neighbor canine area, both of canine holding this, helping the holding this temporary PMMA. Okay. What about this, the profile of the patient? The protrusive upper anterior area, the could be the retruded using this procedure and the temporary PMMA. So the morphology and profile and lip support is better, getting better before the surgery. Okay, the healing situation. After 2 weeks, healing photo here. So the soft tissues already healed on this central incisal area, the ARP socket area, and the lateral incisal areas, the implant, the insertion site, so was also healed, very nice. And soft tissue tone and color and the volume was very nice and good. The healing the healing period, panoramic view, 3 months post-op. At this time point, we took an intraoral scan using the intraoral scanner, Shining 3D scanner, and it looks like this, very nice. Intraoral scanning views are taken. And CT data plus scan data was stitched each other to get the better and the correct data. The CT data from the Dentium CT, the AI occlusal plan was given, and also the already given the scan data is merging each other and stitching automatically, and we can get like this, very nice and ideal occlusal plan and central the inside central line and lip support. All of these situations was done on this the image, the program. The CT data stitching looks like here, so we can move some of tools, the location and the correct positioning, and we can correct the size and length and the angulation and position. All of this situation was collected on this data. So CAD design here. The little bit the big overjet case, overbite case. However, we can correct a little bit retruded situation on upper fourth anterior central incisor and lateral incisor. Upper four incisor teeth was moved to retruded. So profile was getting better. Okay, using the virtual articulator and get some occlusal scheme, and finally we can get the final processes using this program and the stitched data. And the final zirconia, the implant supported 4-unit bridge was shown. The using broad 3-layer zirconia block was used. Final processes made by zirconia 4-unit implant supported bridge was delivered to our patient mouth. Actually, in this case, the screw hole shown up to labial surfaces of final processes. Actually, this kind of situation was accepted by patient because of this patient, the older person. However, if you want to have a little bit more the aesthetic outcome, even though the screw holes on the labial surface, actually you have to make a screw hole, the little bit the beveled screw hole on the zirconia crown, cause of shading, the masking, the fully masking of the metal color underneath this abutment, right? So maybe a little bit the angle looks like here. We can see the outside. We can see the some of metal color or metal the color. However, we may have a little bit the converse type the screw hole. We can peel out this underneath the undercut area, so we can masking some of the color of metal, the screw abutment. So that is a small tip to use to apply to our patient the final restoration, when we have a screw type, especially the screw hole coming on the labial surfaces. However, the patient was happy because of her anterior teeth was retruded, so profile was getting better, as you know, as you can see. So the patient satisfied, and also the doctor satisfied, and doctor happy also. Okay, the final prosthesis panoramic view is here. Two bright TL implant inserted on lateral incisal area, and 4 unit zirconia bridge inserted on this bright TL, the implant system. Very nice, well done, simple, the procedure. And treatment progression, the treatment procedures looks like here. Pre-op, the surgery, and provisional restoration to evaluate the smile line or the soft tissue, the molding, and going to the final restoration. Okay, that was the part of the last month's surgery videos, the outcome. And now we're going to move to this month's surgery. This month's surgery will be performed on our patient, 35 years male patient. His chief complaint was full mouth prosthetic consultation. It means he got more, the better the situation of his dentition. The sum of edentulous area and the partial edentulous, and some the crown and root canal treatment and crown, this kind of situation to make a complicity, to make a final and better the smile line and the outcome of the patient. Okay, the past dental history was here. The implantation on 26, 35, 36. The 3 implant fixtures was installed, already done. And 16, 17, 12 areas extracted 8 months ago. Now we're going to do some of surgeries on this posterior right side maxilla. The maxillary sinus elevation with the Crestal approach, using some of graft material and the bright system. Okay. This one is pre-op intraoral view. We can see the width of posterior maxillar edentulous area is enough. However, the little bit depression due to extraction of this area. What about the sinus? Sinus, the location, the flow of the sinus is at just a little bit the small, the Crestal approach, and elevation is needed to make 7-9 millimeter the implant fixtures inserted in this area, right? The remnant of the bone was 6.4, it almost 7 millimeter. So that is good indication to bicortical fixation or Crestal approach, right? And the 16 area, the first molar areas, is same. Okay, 16 area is getting 16 tooth area is better, the remaining bone, compared to 17 area. So this 17 and 16, the first and second molar areas, will be done by a Crestal approach, just a small bit, and then pushing the bone graft material and implant insertion simultaneously. Especially today, Dr. Chung shown us about this new technique. The naming is Crestal Approach Plus. Crestal Approach Plus means here using the osteon, xenocollagen, and the collagen graft too. What is the detailed process? Okay, the surgery video showing you about more detailed the process and procedure about this Crestal approach 2, Crestal approach plus. And what is a benefit, what is advantages of this procedure? Also, we will be showing you on this surgery video today. Okay? And the bright implant system that is especially tissue level that will be used, the diameter 4.5 and 5.0, the length 7 millimeter. As I mentioned before, always we have to consider the length, the actual length, the actually bright TR system, the naming, the calculating the length, always surface only calculate the surface area, right? So total length of the picture is a little bit different from this the named, the calculated millimeter. For example, 7 millimeter, it means 7 millimeter treated surface plus 1.5 at the metal concave color, and then totally 1.8 millimeter the hex portion. So 3.3 is adding to 7 millimeter. So from the tip to top, total length will be 10 millimeter, right? Exactly 10.3 millimeter. So we have to consider the total length of the picture compared to the bone level implant system. Okay, let me introduce this advanced sinus kit, Dask Simple. Dask Simple consists of 2 compaction drills and 2 lateral drills and bone spreader and hand instrument. The compaction drill have a 2 different diameter, 3.0, 3.5. The lateral drills have a different shank length. Okay, the Crestal drill, as you know, have some using this Dask Simple kit, showing you this diagram, showing you about all the ideas and all the procedure, especially Crestal approach plus. What is plus? Actually, after using the compaction drill, what is next? Did you see the osteon xenocollagen and osteon collagen graft? Yeah, exactly correct. Actually, after using compaction drill, insert collagen graft first. Maybe the suspected perforated membrane will be covered. If suspected perforated membrane was existed case, actually they will be covered and prevent some of tendency of membrane perforation. The both of case can be overcome. So simply perforated or not doesn't matter. Cause of the after using the compaction drill, we're gonna put the collagen graft. This collagen graft working to protect suspected perforated membrane or intact membrane or near perforated membrane. All of these cases covered by using collagen graft. And after that, the making of some space and filled with collagen, osteon xenocollagen, collagenated bone. The particle is osteon xeno, right? The bovine source. The xenograft material and the collagen bone and insert after this, and then using the compaction drill again, and then make some more and more. The cell sinus elevation will be elevated upward, and then finally insert of implant fixture. Okay, all these procedures named Crestal approach plus. Okay, about the tissue level of bright implant, so many times the already introduced you the external 20-degree external connection type and the fatty belly style. The middle portion is wider than the apex and top, and the platform the same one size. The same size, one size platform, 3.8 millimeter, and one connection, Another naming is a single connection for the convenient procedure, the prosthetic procedure. And the 1.5 gingival height. This one is actually have some the gingival color, working as gingival color, concave form, and the gingival former. And the more the getting better and more good the emergency profile situation when we have a prosthetic procedure after insertion this implant fixture. And all of these the mechanics and details the melted in this development of the brand new the Bright TL system. So Bright TL system, the unique and the versatile and to give lots of favor to use the user. Okay, the osteogenocollagen also introduced many times already. And the collagen graft 1D, this actually 1D and 2D have some difference, depend up to the collagen density and the similar the texture. However, the collagen density is different. So the collagen density, smaller collagen density is 1D, the tight packer 2D. Okay, let's move to today's surgery. Please remind all of this introduction of today's biomaterial to move to today's surgery video. And you can see and you can find out some of interesting of the using the biomaterial properly on this kind of the Crestal approach. Okay, the flapless surgery was tried using the Lindemann drill. The drill speed 50 RPM without irrigation. Actually, this academic background, the strong academic background, the 50 RPM, without the saline irrigation is safe. Actually, the harm to any harmful to the bone. So you don't worry about this, the heating to the bone. So it is harmless procedure, the 50 RPM without irrigation. After that, the checking the pass with using the pass pin and the Lindemann again about the number 27 area. Always we have to calculate the correct remaining bone and soft tissue depths when we have a flapless surgery, right? So the soft tissue thickness, there may be 2 millimeter, and the remaining bone, the 6 millimeter, and right, the 8 millimeter insertion, always under 8 millimeter. And after that, changing the drill with the compaction drill until the removing the resistance of the hardness. It means the flower of the sinus flower, the grinding, sinus flower, the perforating, right? And after that, the drop it out, the drill, and checking this depth gauge, the membrane intact or not. There's actually a little bit resistance of inside of the cavity. It means intact membrane. However, without any resistance means suspected. We can suspect the perforated membrane. Okay, and after that, checking the intact membrane. Sometimes we can use this kind of elephant foot, the dome-shaped round curette, to detach sinus membrane from the floor. And this procedure, this step is the key of Crestal approach plus. Can you see the biomaterial? This one is collagen graft X1D. This collagen graft is the highly dense collagen, the matrix, right? So using this collagen graft gave us a favor First one, preventing the perforation. The second, if perforated cases, a small perforation can be overcome and sealed by using this collagen graft. And number 3 is suspected perforated the membrane. Cause of this Crestal approach is the blind technique. So frequently we can get some suspected perforated membrane situation. However, this collagen graft to prevent and overcome this membrane perforation. And after that, this collagen graft give us some space for allowing the graft matures into the sinus cavity between membrane and floor. Okay, this one is bone spreader. The starting into the sinus cavity, the spreading the graft matures evenly into the sinus cavities, right? This one is not mandatory, it's actually optional. So if you want to use, you can use this one. However, you don't want it, okay, just skip. After stirring and after spreading all the graft matures into the sinus cavities evenly, after detaching the sinus membrane, using this mature and instrument, and after that, the pushing again with osteogenocollagen. This one is bone graft matures. Bone graft matures, collagenated bone graft matures gave us a big vapor, as I mentioned before. The first one, actually particulated bone, sometimes scattered each other and difficult to handle. However, the collagenated bone graft materials like osteogenocollagen is easy to handle, easy to mold, and not too much scattered. So this one is efficient to have sinus elevation or GBR procedure and the minor bone grafting procedure. Nowadays, I can tell you this collagenated bone has prevailed widely. All of the implant bone grafting the field. Okay, the final bone grafting was done. Once again, Dr. Chung wanna get some more pushing the implant, pushing the graft material into the osteotomy site. This fragmented the osteogenocollagen was inserted through this osteotomy hole into the sinus cavity. Okay, he wants some more. I make a small pieces from the cylinder type, the osteogenocollagen, the package, and then pushing each other, the small and small, the particle, the pieces of osteogenocollagen. Okay, and finally, this implant fixture was inserted into the number 17, the second molar area. the bright TL system, the diameter 50, length is 7 millimeter. Oh, diameter 4.5, sorry. The 4.5, the 7 millimeter. Okay, now move to number 16 area. The same procedure that will be done. Actually, did you see this final drill? This final drill, the Lindemann style final drill. Nowadays, Dentium developed actually totally 3 different type final drill. First one, the standard drill. Second, stopper drill. The standard drill, however, all the different lengths and with the stopper case, so that is easy to have a multiple implantation. Finally, this Lindemann style drill. This one is efficiency, to make it higher efficiency, the bone grounding. So faster, very faster, the osteotomy site making. Especially this drill is to make it power, the hard bone, like type 1 and 2, lower the jaw, the posterior and anterior area. This Lindemann drill to prevent the slippery on this inclined surface of the bone, and sometimes exactly the correct point drilling case. Actually, this the Lindemann type, the final drill, give us efficiency and the favor and good advantages. So, if possible, you may use this Lindemann type final drill when you have the hard bone or osteotomy site. Okay, already done of this 16 osteotomy. Okay, now bright TL, another fixture, diameter 5.0, 7 millimeter was inserted on the first molar area. Yeah, the fully engaged. Now depth control to making better the emergence profile, final prosthesis, and the depth control, and then removing the plastic cap. This plastic cap working as protection of screw hole, and the changing this scan comfort cap. This scan comfort cap, the working 3 different uses. First one, working as scanning jig. Second one, healing abutment. The third one, sometimes you can use the temporary abutment, like a dual abutment for the supine implant system. When you use this scan comfort cap, the after insertion bright TR system, always try to choose non-hex type. That is better to use and apply. Okay, the final lustration case, actually, when we have a final lustration type, totally different story. At this time, we're going to use hex scan comfort cap or scan the abutment. However, like this, just after surgery case, the non-hex type is better to use, and the connection. Okay, the surgery was done very fast, looking like the flowing the stream, and now we will have a 5-minute break, and also we will have a Q&A session after that. Thank you for watching. Stay tuned. Okay, thank you for waiting. Now we're going to see the post-op, the intraoral view, number 17 and 16, the very nice, the well done, performed, and ISB, the 90 and 79, the very high ISB score. It means a strong engagement with the bone and higher initial stability. This one is post-op PA view. Can you see this number 17, the second molar area? The very nice, well done dome shape, the elevated sinus membrane, and this membrane looks like the lateral approach case, right? So the ordinary speaking, generally speaking, the lateral approach case, the membrane, the easily to make a dome-shaped, widespread, wide, separate from the sinus floor and make a little bit dome style and make a wider and big space to accept bone grafting material. However, Crestal approach case, actually it is very difficult to make this dome shape, big dome shape sinus elevation. How can Dr. Chung achieve this kind of situation? Right? The Crestal approach plus a procedure. So after using the Crestal drill to separate the sinus membrane, and after that using the dome shape sinus curette, another name is elephant foot. However, the key is here, the collagen graft. Make some small pieces of collagen graft, soaking with saline and pushing through the osteotomy site and into the sinus cavity, and then using again the pushing again with the Crestal drill. So this collagen graft spread widely and give pressure evenly, right? That is the correct and the perfect selection. Sometimes we're going to use hydraulic power to elevate the sinus membrane, but sometimes that depend on the flower inclination. Sinus membrane, some part of sinus membrane elevated well, another part is poor. So the sinus membrane is not even elevated, even though the hydraulic power system. However, this collagen graft system, using the collagen graft, the Crestal approach plus procedure system is, that doesn't matter. Always even size and even the power given to the sinus floor, and very nice, well done, and looks like the lateral approach style, dome shape, elevate of sinus membrane, and also the bone formative cells, many of the bone formative cells are from the sinus floor and the membrane. As you know, the cell source, bone making cell source came from floor and sinus membrane. So widespread means the better and many bone cells comes from this area. So the faster bone formation and the bone quality will be good. And finally, you can use these areas well elevated and well bone grafted and well inserted. Very nice procedures was done. Post-op CT looks like here, 17 and 16 areas. Also membrane was elevated evenly, and the bone grafted materials are inserted. Osteogeno came from the bovine. However, collect from cancellous bone source. So at the first time, not so the big radiopack situation. However, after time, these areas will be more radiopack cause of newly forming bone. Okay, so you can see 3 months after, more radiopack situation on this site. Okay, 1 week healing situation. Cause of plastic surgery, not necessary to suture, and the faster soft tissue healing. That is natural. Okay, let's move to Q&A session. Today we have two very nice, very good two questions. Number one, what would you do if the bone quality is poor for implant placement? Generally speaking, poor bone quality site manipulation, we have to do the undersized drill, bone squeezing, bone compressing. That is another way to make a little bit denser bone, and the generally we can use undersized drill, right? And another one is poor bone quality case. Actually, we have to choose. We have to select the proper implant system, right? So the pat belly style, the middle portion of fixture is the fatty and the big diameter compared to apex and top portion. It means the middle portion engage cancellous bone. The poor bone quality case is actually the softer the cancellous bone and the thin, the small volume or cortical, right? So instead of taper style, taper type fixture, you have to choose the fat belly style fixture is better, right? Again, fat belly style, like bright TL system, is much better to apply this poor bone quality. So first, procedure. Second, correct implant system selection. Okay. The second question is here. How do you manage sinus membrane population during sinus lift? Very nice and general the question about the sinus elevation procedure. Actually, we have to divide lateral approach case and Crestal approach case. The first, Crestal approach case. Crestal approach case, the population is very difficult to overcome, actually. Ideally, we can remove more separate the sinus membrane from the sinus floor and detach the sinus membrane from the floor a little bit more and more apart from populated area. Theoretically, and in our brain, it is working well. However, our hand is very difficult to perform this kind of idea. So, when you have a population, the big population case, the Crestal approach, the flipping to the lateral approach, that is a good idea. That is a correct procedure. So, a little bit more big, wide, trapezoidal incision and flexion, and expose the lateral wall of the sinus and grind out or to punch out. There are many different ways. Anyway, to remove the lateral wall and separate the sinus membrane from the lateral wall and a little bit more and more detach. And finally, we can see the small population of the sinus area, the populated membrane area from the Crestal during the Crestal approach case. And after that, elevate and cover some of the collagen membrane or collagen graft or some collagen sponge materials and put the graft materials, and same as normal lateral approach procedures will be done. And that is my answer about the Crestal approach case population. Another one, the lateral approach, the population case is totally different. The already done the lateral window and elevation, and during the detachment, easy to tear of the sinus membrane. What is next? How can I perform and overcome this kind of the badly situation? So calm down and then don't touch anymore the populated areas of the sinus membrane, and we have to make a little bit wider window far from this populated area, right? It looks like a small lateral window should we make a little bit wider and wider. Nowadays, actually, wider the horizontally, cause of the upper part is dangerous zone, as you know, the running away, the arteries and the little bit difficult to access. So nowadays a little bit wide trench style window is better. And after that, detach from this intact area. And the detachment a little bit more and more, and the approach to the populated area is already, and then this populated area is already automatically elevated with intact sinus membrane. And after that, the small perforated membrane case actually flip each other because of the reduced tension of the sinus membrane. So after that, we cannot see the perforated areas, even though, however, still remaining the perforated areas on the sinus membrane, we have to cover the collagen membrane, collagen graft, or some collagen sponge, and cover the sinus membrane of the perforated area, and then put the graft materials again. The next step is the same as normal lateral approach case, right? So, depend on the procedure, the different approach of overcome method. Okay? Thank you for watching today's surgery video, and see you next time. Actually, if you missed any part of today's session,